guys, we'll be studying about the Rhomberg sign, Stereognosis and Dissociated Anesthesia. So Rhomberg sign is a very important question for 5 marks. So what is happening in the sense, the person or the patient is unable to maintain the balanced standing position with the feet together and eyes closed. He is not being able to balance his position. He is not being able to stand in a proper way with the feet closed, feet together and eyes closed. Inability to maintain the balanced standing position with the feet together and eyes closed. Why is this happening? It is happening due to the lack of sense of position in both the legs. There is no proper sense of position between both the legs. The patient should be tested in the bare foot. Always remember this. The patient should be tested with the bare foot. It is called as the sensory ataxia. So ataxia can also occur in the cerebellar disease or the vestibulopathy. If there is any problem in your ear equilibrium or maintenance of the posture, you can see this. Okay, then what is stereognosis? Stereognosis definition and its properties you have to know. So it is the ability to identify the known object by handling them with the eyes closed. In the sense, if my eyes are closed and if the doctor have given me a known object which I know, and I have to touch this object, I have to feel it, I have to sense it, then I have to tell what is this object. I have to be closed, my eyes have to be closed, and I have to tell this is a eraser plus sharp. I have to tell this is some equipment, this is some eraser. So in the same way, it is the ability to identify the known object by handling with closed eyes. So what are the receptor acting here? There will be touch receptors. You'll be touching it. You'll put pressure against it so that you can see whether the object is hard or a softer one. So there will be use of touch receptor and pressure receptor. Which is the pathway mainly involved? Is the dorsal column pathway is mainly involved. It is the ability to identify the known object by the closed eyes, with the closed eyes. So some of the clinical significance of the stereognosis. So inability to identify the known objects by touch. If you are not being able to identify the object with the touch sensation, then it is called as astereognosis. Opposite of stereognosis, astereognosis, or tactile agnosia. Tactile in the sense touch agnosia. Agnosia in the sense you are not being able to sense it. Absence of sensation. Inability to identify the known object by sight is known as visual agnosia. Sight is visual agnosia. Sound or words is by auditory agnosia. If you are not able to identify the sound or words, is called as auditory agnosia. Inability to identify the position of the limb. You are not being able to identify the position of the limb. It is called as positional agnosia. This stereognosis mainly affects the dorsal column pathway or the dorsal root ganglion. It mainly affects the dorsal column pathways. Impaired stereognosis is the early sign for the cortical pathology. There might be problem in your cortex, sensory cortex. It is due to the touch and pressure sensation will be lost. So you won't be able to touch and feel the things. So there might be some problem in the cortex. Last topic is dissociated sensation, anesthesia of this ascending pathway. So the final topic is dissociated anesthesia. The sensation of pain and touch is lost, whereas there will be preservation of the sensation of the pain and temperature will be lost, whereas there will be preservation of the touch sensation. So you can see pain, temperature will be lost. That patient won't be able to sense the pain and temperature, but touch will be preserved. What are the causes? Syringomyelina, I have explained about this, and Brown-Sequard syndrome in the sensory abnormalities chapter. So intramedullary tumors might be grown. There might be lesions in the brainstem, in the midbrain, middle oblongate or pons. There might be thrombosis. Blood clot might occur in the posterior inferior cerebellar artery, which might lead the lesion in the ventroposterior lateral and VPL and VPM nucleus, ventroposterior medial nucleus. So what is its physiological basis? It occurs due to spinal cord gray matter surrounding the central canal is damaged. This is about syringomyelina. If there is a spinal cord, the central canal of the spinal cord will be affected. The fibers of the spinothalamic tract that carries pain and temperature while crossing over the opposite side of the spinal cord are placed close to the central canal. So there will be disturbance, and what happens in the sense, these pathway, instead of in the actual position, they'll be arranged quite closer to the central canal. Instead of being arranged in the original position, they'll be arranged a bit closer to the central canal of the spinal cord. These fibers are damaged in the disease process, loss of pain and temperature. Because of all these conditions, what happens? These fibers will get ultimately damaged and might cause lesions or problems in the spinal cord. There will be loss of sensation and pain and temperature, but there will be preservation of touch. These are the causes. So that's what about the dissociated anesthesia. Hope you have liked the video. This is about the ascending pathway, a very important chapter. They'll be asking usually about the dorsal column pathway or anterolateral pathway and one of its clinical significance. If there is any lesion in the anterolateral pathway, you can see the Syringomyelina. If there is any lesion in the dorsal column pathway, you can see the Brown-Sequard syndrome. So you have to study all these important topics and do study some of the basics, the naming parts, so that it might help you in the further chapters. So please do like, share and subscribe. Thank you.